Hello, I'm Leslie Kendrick. I'm a professor in the Department of Radiologic Sciences here at Boise State University, and we're excited to have you here on Bronco Day. I'm going to take just a moment to share my screen here, and I'd like to talk with you about the programs that we have at Boise State University in the Department of Radiologic Sciences. Before I get started talking about our programs, I wanted to take just a minute to talk about who is an imaging technologist. An imaging technologist is an individual who has received a degree, an academic degree, in medical imaging. This individual has learned the science behind manipulating electromagnetic waves in order to produce medical images. This person is part of the healthcare team. This individual works with fellow medical imaging technologists. They also work with the physician who is responsible for interpreting the medical images. This is the radiologist. And they also are responsible for working within the healthcare realm with other healthcare professionals. This individual is an important part of providing the quality care an individual needs to receive in a healthcare environment. An imaging technologist must understand the science behind human anatomy and physiology. This individual must be able to position and manipulate the human body in order to complete the examination protocols necessary to create the medical images that the physician needs for his interpretation. The individual must understand the physics behind electromagnetic waveforms, and also they must understand what are those interactions of the waveforms with matter. This individual must understand how to provide their imaging technology in a safe manner in order to produce the appropriate images following protocols and procedures, but also to keep themselves and their patients safe. This individual must have education in the fields of pharmacology and chemistry, and also understand how to provide the best and most appropriate patient and customer care. The primary pathway into medical imaging at Boise State is through our diagnostic radiology program. This is a Bachelor of Science program. It's 1 year of prerequisite coursework. Then students apply for acceptance into the final 3 years for the total of a 4-year baccalaureate program. We will accept up to 28 students, I should say at least 28 students on an annual basis. And the end of this program will result in a credentialing opportunity through the American Registry of Radiologic Technologists, our nationally recognized credentialing body. And this program operates under the guides of the JRC-ERT, which is our programmatic accreditation body. Students who complete the prerequisites, which are the 8 credits of English and 8 credits of biology and anatomy and physiology, 4 credits in the chemistry, which you can choose to take Chem 101 plus a lab or Chem 111 plus a lab. And how do you choose which one? You would identify whether you plan to go on for anything beyond medical imaging, and if you decide to go that you want to go into like PA school or med school, want to set yourself to be eligible to do so, then it would be most appropriate for you to take the Chem 111. Students need to take the college algebra, or if you have passed out of college algebra and need to meet the university math and another matter, you can take the next level, which would be Math 170, which is Calculus 1. Students may also enroll as a prerequisite. It's required that you take the physics. I said physics and I meant psychology. Psychology 101, which is the general psychology class, and then also Health 101, which is the medical terminology. In order to keep students on track for graduation, we ask that as part of the prerequisite year, you complete 3 credits of the foundational art and humanities. One of those, whether it's the 3 credits art or whether it's 3 credits of foundational humanities, just one of those classes. Students also need to demonstrate their ability to work with their computers and understand how to get through the requirements of using spreadsheets, using word processing software, and then also your database software. And you can do that by taking the ITM 104, 105, 106 series, or you can take the placement exams are offered through the College of Business and Economics for computer competency. Diagnostic radiology is a very exciting field. There is a wide variety of places that technologists will place themselves throughout the hospital environments and also clinical environments. We work with patients on general radiographic imaging, such as you see here, working with their extremities, their appendicular skeleton. We can also be working in the surgery departments, working with physicians in where we look at things such as lumbar fusions and all kinds of surgical interventions that will be part of providing the imaging that's necessary for the physicians to know where they are within the human body. And then also we may deal with some real-time imaging and looking at the function of structures as we have individuals drink various things or we introduce things into the body for demonstration of soft tissue and their function. We also provide secondary pathways into medical imaging at Boise State. The secondary pathways that we offer are computed tomography, diagnostic medical sonography, and magnetic resonance imaging. All three of these advanced imaging programs will result in individuals being eligible to sit for national credentialing exams as well. Computed tomography is a one-semester program. It does have didactic and clinical experience requirements, just like radiography. It also has an application and interview process. Computed tomography is really exciting field. It is a fast-paced field. You see multiple patients throughout the day. You can look for all kinds of things throughout the chest or the abdomen and pelvis, throughout the skeletal structures. We do have 3D imaging. We're looking at reconstructive surgical pre-planning and things like that. It's a very fast-paced environment, like I said, and wide variety of patients can be seen in the computed tomography department on a daily basis. Diagnostic medical sonography is a 2-semester plus a summer clinical requirement. It also has prerequisites. It has an application and an acceptance process, and students do complete didactic and clinical experience throughout the entire program. And like I said, students will be able to sit for multiple credentialing exams at the end of this program, and it also has programmatic accreditation overseeing the instruction and clinical opportunities offered to the students. Diagnostic medical sonography is a very exciting field. It does have a component that is associated with fetal imaging of fetus inside the baby, and then potentially reconstructions of those imaging for families. It's also a very exciting field that looks at soft tissue structures within the abdomen and the pelvis, also looking at glandular structures, as you see what she's looking at here, which would be the thyroid gland. You can even look at a child's brain through the fontanelles, the holes within the skull as an infant. And then the last academic program that we offer that is considered an advanced imaging modality at Boise State is magnetic resonance imaging, MRI. MRI is a 2-semester program. It also has the opportunity for students to complete the program as a baccalaureate degree, or it can also be an academic certificate like you've seen as the other advanced imaging modalities. It has the prerequisites as well. It does have an application and an acceptance process, and then students can sit for credentialing exams at the end. Students, when in choosing whether to use this as a second bachelor's opportunity or a single bachelor's opportunity, it all depends on the student's preferences and what they're looking for at the end. If a student has an associate degree as a transferring into Boise State, and that associate degree is in a field of medical imaging, then in MRI and CT, students can complete their second bachelor's degree, or they can choose to do an academic certificate. Now, sonography is a little bit different. If you have an academic degree that is an associate degree in any clinically based program, whether that's like ultrasound, sorry, not ultrasound, that is ultrasound, like respiratory care or maybe nursing, you could apply for the sonography program and be eligible to be accepted into and advance your career in the realm of sonography. MRI is a really exciting field. It is a field that allows you to look inside of the body and with yet another type of electromagnetic waveform, radio frequencies, and create signals that come off of the soft tissues inside of our body. We look at things, tiny little things that are in the brain, and even things like the spinal cord or muscles and ligaments and tendons around joints, or also look at vascular structures. So much like the other modalities that you may have seen with computed tomography and sonography, MRI is also a really exciting field. You might see in our catalog that we have a program that's called Imaging Sciences. This is an associate to baccalaureate degree program. It is a program for students who already have an associate degree in medical imaging, and they would like to complete their bachelor's degree without having to complete more clinical requirements and don't have to come onto campus, but instead can complete this completely online. So this is for the students to complete a bachelor's degree in 1 year or full-time or in 2 years part-time. Students are very active on campus through our Student Association of Radiologic Technologists organization. This is a student-run organization that is highly active on campus with things like homecoming parades, or whether that's putting on picnics for new incoming students. They are engaged across campus in a wide variety of ways. Students are also involved in the community. They'll go out in the community with their association. The SART Association, Student Association of Radiologic Technologists, will go out in the community and put on workshops for elementary schools, learning what is the field of medical imaging, but also learning how to be an effective healthcare provider. And students will also be part of community events that are fundraisers for various organizations, such as here, or also participating in things such as Break Up Boise or Paint the Town. Students are also involved in national and state conference opportunities where they will be part of student competitions or where they will present their research. And many times, I would say many times, more often than not, students will come back as winners from our national or our state conferences. And so we're always very excited to share that with the university community on the successes of our students. Students can also be part of a National Honor Society that's specific to radiologic and imaging sciences. We are so excited for this opportunity for students to be recognized for their successes. And also as part of this, students will have an annual pinning ceremony. And in that pinning ceremony, they may also be graduating with the rest of their class and celebrating with the rest of their class through an annual celebration of graduation. And so we're always proud of the opportunities we get to celebrate with our students their many successes. If you are interested in our programs and would like to hear more about radiologic sciences and all of the things that we offer in our departments and our programs and requirements that you may need to meet in order to be eligible to apply, we encourage you to meet with our academic advisor. Our pre-radiologic sciences advisor is Olga Salinas. Here is our email address. If you would like to talk with one of the faculty in the department about a specific program, please feel free to contact our business assistant, Sue Antonich, and she can direct you to the correct faculty member. I want to thank you so much for taking your day and spending it with Boise State and the Department of Radiologic Sciences, and we hope to hear from you and we hope to see you in the future. Take care. Thanks again for taking a few minutes with our department.